Hi, everyone. Thank you for being with us tonight for the Life and Breath Foundation Speaker Series. This evening, we'll be discussing the topic of mastering the conversation with our special guest, Tiffany Ryder. Thank you all for being with us. My name's Alexis Holm, a volunteer of the Life and Breath Foundation. Our goals of the Life and Breath Foundation are to offer the sarcoidosis community the effective tools to track their journey, decipher medical issues, and maximize the quality of life. To provide a nurturing environment for those affected by sarcoidosis, to share their experiences, and to build more awareness within the medical community to help combat this chronic disease. What we do at the Life and Breath Foundation is we are a volunteer-led organization. All of the money that we receive through our generous donations and our sponsorships go directly to supporting patients who have sarcoidosis. Some of our services include speaker series, like what you're viewing today. All of our replays are accessible on the YouTube channel, Life and Breath Foundation. We also have a Life and Breath Scholar program for physician education, patient support from sarcoid experts, and then patient support through sponsorships and education. We also have a Life and Breath planner that's available through e-download or a paper download. And now for our guest, Tiffany Ryder. She's a dynamic and influential speaker, clinician, entrepreneur, and advocate for transformative change in the healthcare industry. With over 2 decades of experience, Tiffany offers thought-provoking insights into the intersection of medicine, business, and empowerment. Her engaging talks inspire diverse audiences, from medical professionals to business leaders, to challenge the status quo and drive positive impact. Now, before I pass it over to Tiffany, we want to give this disclaimer. This webinar is not giving medical advice. No doctor-patient relationship has been established by talking with Tiffany during this meeting. Our speaker does not know your medical background and can therefore not give you specific medical advice. Speak with your doctor before acting on any of the information you hear this evening. Now I'm going to turn it over to Tiffany. Thanks for being with us.
Yeah, I'm so excited to be here. I'll be more excited once I can successfully pull up my PowerPoint presentation. But thank you so much. Ta-da!
We see.
All right. Yeah, so again, thank you so much for having me and inviting me. I'm so passionate about this topic in general of really giving people tips and tools and actionable items that they can use when they're engaging with the medical system and trying to navigate everything. I think it's a really high bar to expect of anyone, myself included. Even though I'm in the system, it is sometimes incredibly difficult to figure out, what to do next. And so, what I hope you get from the next few minutes that we spend together is really just a sense of, how to look at these interactions that you're having with the medical system and to enter into those with a sense of comfort and empowerment, like you understand what to expect and how to get the things that you need from those interactions. So it sounds contrived, but I can honestly say that I ended up on a business call today with someone in the health tech industry. And this is someone I've had a call with several times before. And I said, we've never really talked about like how we ended up in this space. Tell me a little bit about like, what's your why? Because, being a clinician, being in healthcare at all, most people have a reason that drove them there. And he starts to share with me, and he goes through and he says, starts the conversation by saying, well, my dad died at a time that he didn't have to, which is, was a powerful statement right out the bat. And I said, well, tell me more about that. What do you mean? And he goes through a story and he talks about how his dad wasn't feeling well and he went to see his primary care doc that he'd, been seeing for a great portion of his life. And he was having, some like belly pain, chest pain stuff, but nothing that seemed major. And he was discharged or discharged. He was told that it wasn't, any big deal. Just go home, take some Tums, see what happens. It's okay. Come back if it's not getting better. So he comes back a couple of days later and now he's got like a little bit of a cough and the doctor says, well, maybe this indigestion is causing a cough. Maybe you've got something else going on, gave him some cough medicine and said, just come back if there's anything else that's going on. And so the third time that his dad goes back, he says, I just really feel horrible. And the man that I was speaking with, his son says, he called me that night and he said, I feel terrible. I feel like I'm dying. Like, I don't know what's going on. And he said, that's, it's okay. Like, you're going to be okay. And it turns out that, the gentleman was having a cardiac problem and that he wasn't okay. And, and the conversation that we were having was, how could that conversation, any of those conversations had been different if anybody along the line had known to ask more questions, right? If there had been a more open dialogue, if the dad had felt comfortable asking more questions or had maybe known what to say or how to say it in a way that that his physician could hear, or if the language had been such that really the message could have gotten through, that this wasn't a run-of-the-mill minor complaint. And so that's what we're talking about today is how to get to a place where we have a shared language and we're able to communicate what our concerns are, whether it's the patient themselves or it's a family member, or for clinicians like me who are on the other side to know what we need to do to hear better. So I had this wonderful introduction, but just a little about what I do. I consider myself to be a patient advocate because everything that I do has to do with improving the medical experience, because certainly worldwide, I think it is a challenge for patients to come to the table and get the care that they need. And certainly in the US, we have specific struggles with that. I'm an emergency medicine PA by training. So I have practiced in the emergency room, practiced through COVID, and had my fair share of experiences where I wish that communication was better. I'm the founder. I've recently launched a publication called Red Flag Hero. So that is the little logo in the corner of all of my slides. And I'm really excited about that. It's essentially just a free publication that I am writing on a weekly basis to bring some of this type of information to patients. And then I'm serving as a medical director and one of the founders at a nonprofit called Direct Care Connect, where we look to help underinsured and uninsured patients find medical care and basic baseline medical care, primary care doctors, things like that. So this is a very accurate picture of what the emergency room looked like a couple of years ago. Some of them still look like this, but it is it's an interesting place to learn about how important streamlining communication is. And so really this is my point of reference. I've never practiced in any other specialty. I have been a patient, I have been a community member, a family member, and have been in the ER. And so that's sort of the light that I'm hoping to bring. We unfortunately, when we meet our patients, we really don't know anything about them. And so it creates a unique opportunity to look at how do we streamline, how do we get the best information possible in the worst environment possible. Anecdotally, when I think about, why it's so important, it's because communication results in better outcomes. And, I've gone and I've looked for data, as I've written about this or presented about this in, to other professionals and to clinicians in professional settings, like, well, where is the data? Do we have data that shows that this very obvious common sense thing, communication results in better outcomes, actually does? And we do. One of the most interesting studies that I've come across is the study that looked at the number of unnecessary medical events over a 10-year period in the US. And they went through and they were looking at things like over-testing and over-treatment, not even mentioning the other side of under-testing and under-treatment, misdiagnoses, which I know that, people with more complex medical syndromes all go through. But just looking at over-testing, over-treatment, unnecessary events, there was a huge number. Iatrogenic is our fancy word of saying hospital-caused, clinician-caused events. So, wrong dose, wrong patient, an infection that someone gets in the hospital. So these things are not, they're not these lapses in communication, these miscommunications are really not without consequence. There's an inherent consequence to the patients, but the iatrogenic is just the icing on the cake. And when you look at communication, why is it harder in the medical setting? I mean, communication's harder all of the time, but we have special things that really make it more of a challenge. Things like time constraints, which we're all dealing with, your doctor's dealing with, and patients are dealing with. The fact that we don't necessarily have a shared language. So a very common thing that comes up is the word dizziness. So we all think that we know what dizziness means. But when my kid at home tells me that she's dizzy, that means something different to me than when a colleague at work says that a patient is dizzy, right? So dizziness to a medical professional usually refers to this, is the room spinning type sensation where, many of us say dizzy, oh, I feel dizzy, and that really means lightheaded, or I feel like I'm gonna pass out. So understanding that, there is medical jargon that maybe I say a word that, you completely have never heard of before because you're not in medicine. But then there's also things like common words that, you don't even know are, potentially being misused or misinterpreted. There's multiple specialties involved, especially, in a condition like sarcoidosis that affects multiple organ systems. I mean, you really have so many people who are here trying to help, but maybe not talking to each other, which obviously creates some difficulties. There are difficulties with access to labs or imaging or, other tests that may be done, and the sharing between those, which I know that someone actually, thankfully, wrote in a question on, right? So that's something that we have to think about. And then there's this concept of provider burnout, which we all hear about, but also patient burnout over time. So, having patients who have to interact with the medical system consistently really creates an emotional toll, and a time toll, a financial strain. I mean, it's not a small thing for someone to have to go through. And that's something that we really, makes communication more difficult. So the lie that patients believe, and I think that if you take anything from our conversation, this is what I hope that you remember. And the lie that patients believe is that your doctor knows the best way to treat you at all times. And that is not a diss on doctors or clinicians or PAs. It is simply to say that, when you're when you're a young child and you fall and you hurt your knee and you're like, oh gosh, am I dying? And you look around and you see, and then, there's a parent, there's a teacher, there's someone there who knows, and you say, ah, that adult is there. And then you grow up and then you have a situation and you realize, oh my gosh, I'm the adult in this situation. And I think that's a very similar situation to the situation that we encounter in medicine. Yes, your doctor is, incredibly well versed in medicine and the study of medicine, and they have pattern recognition and they've seen many patients. But, if we're honest, like we don't you don't know what you don't know. And we certainly don't know, how our patients are going to react to different treatments or medications, or how your condition is going to change over time. So I think these are all things that, we have to give grace to our clinicians as well and say everyone's doing their best. But you're not going to hit perfect 100% of the time, unfortunately. And with that, I can do the best that I can with the best training that I have and all the information. But at the end of the day, the patient is the decision maker. You are the decision maker, because you have all of the responsibility, right? If you go on a treatment plan that is helpful to you, you are the one who benefits the most. But at the same time, if it's a treatment plan that you're not comfortable with for some reason, or that isn't working for you, then the patient is the one who suffers the negative consequences of that too. And so I think it sounds buzzwordy to say you should be empowered, you get to make the decisions, but it is so true. Like there's nothing truer than that statement. And so that's the mindset that I approach all of this from, is I am your consultant and you are the boss. So what can I do to help you come to the best decision that you can come to, just as an attorney would do in a legal situation, or your CPA does for your taxes. So communication tends to break down in several predictable ways. I think there are certainly more than these, but these are some very common things that we see. And it's something as simple as, just omissions and miscommunications that happen. And how do those miscommunications happen? And what can we do to stop them? And so one thing that we can do that I know, you've probably heard, but prepare for your appointments, whether it's an appointment that's planned or it's, oh my gosh, I think I'm having a life-threatening emergency, and you grab all of the things and you're headed out the door. But having a list of all the medications and supplements that you're on, with dose and frequency, is really helpful. A lot of people are able to remember what medications they're on, but in the emergency setting, sometimes it's not clear what dose they're on, or, well, my doctor put me on that, but I'm not exactly sure why, or he said I was going to take it for, a certain amount of time, but I don't remember when I was supposed to stop it. So having all of that somewhere, like the Life and Breath Foundation's planner, would be amazing. I downloaded that planner. I thought it was, incredible, especially from my perspective in the emergency room. There's nothing better than when a patient shows up and they say, this is what I'm taking. These are my tests from last time. Something that is incredibly important and often gets missed, again, especially in the emergency setting where stress is high and things are, everything is elevated and everything is harder, is the timeline of symptoms. I know that you have back pain and that you've had back pain for the last 5 years, but what about that back pain brought you in today? And, once you dig in there, you often find out, well, I have had back pain for 5 years, but today it got so bad that I couldn't walk and then I couldn't feel my left leg. Like, that's really why you're here. It's really the timeline of symptoms. So having something like that sort of sketched out, just so that you're very clear when, the doctor or the clinician walks in and you all of a sudden forgot all of the things that you wanted to say, is helpful. And then just having any specific questions or concerns written down is also a good practice. trying to avoid being judged is something that we don't talk a lot about, but I think is a key piece of this. Medical appointments obviously should not include judgment. You should feel very comfortable being yourself. But what I found is that, it's two humans in the same room, and it's very easy to forget that, things that you might omit because you don't want to talk about your sexual practices or your drug and alcohol use, or, the fact that your doctor told you to work out and you haven't really done any of that. Like, those things seem like innocent omissions, but some of these things can have a big impact in driving the diagnosis and allowing your doctor to really understand what's going on with you. And so I always encourage people, I know it's embarrassing, I know it's weird, but actually we've seen 8,000 patients, and we've seen really scary, horrific, strange, like the whole gamut. And so anything that you are scared to share is usually not as bad as it seems, at least from our side of the table. And we talked about that. Being agreeable to avoid conflict. I saw this. This actually was another question that someone sent in. I believe the question said something to the effect of, how do I tell my doctor that I'm not really comfortable going along with this protocol when, like, without like hurting their feelings or without damaging the relationship in some way that is not going to be good for anybody in the end? And I think that's a valid concern that a lot of people have. In my research, I was looking for statistics on, how often does this happen? And apparently it happens a lot. I found this statistic that was showing that really 20 to 30% of prescriptions go unfilled and 50% of prescriptions aren't taken. And so when you look at that, there's some element of perhaps some people, there's a unavailability of the medication, or, some degree of, well, maybe that person got better suddenly. But some portion of this 50%, I would bet, is that the patient really never intended to take the medication in the first place. And I do hear that a lot from the emergency room side. Someone will say, look, my doctor gave me this antibiotic, but I didn't really want to take it, and I didn't really want to tell them that, right? And I think that this sort of thing does happen probably more often than we would like to admit, that, patients, like, you don't want to argue, you don't want to be difficult, you want to get great care next time you have something going on. You don't want to be a crazy person who's non-compliant. And so we sort of make these little fudges, little lies that we tell, where we say, oh, okay, sure, yeah, sounds good, and so we can get out of there. And then what it does is it sets you up in a position where now you really have no help, because the doctor is thinking that you're leaving, and this is the path that you're on, and gave you instructions based on that. But really, that's never going to happen. And so I think that's something just to sort of check in with yourself and see, am I doing that? Do I have a habit of doing that? What can I do instead? I'm going to provide these to you guys if it's okay, and maybe you can attach them in the YouTube notes or whatever it is. But I think that there are some basic questions that that having them like sort of written down anytime you have to interact with the medical community is helpful. If you're prescribed a medication, it's really important to know, is it essential? So if I go into the doctor and they think I'm having, I don't know, I have bronchitis, and maybe I get a steroid, maybe I get an antibiotic, an inhaler, and a cough suppressant. So those are 4 different medications. Like, I really need to know, which medicines do I need to take absolutely to be able to get better? Which medications are maybe just going to make me feel better, or which medicines are like, well, I'd like you to take this because maybe it, takes care of the inflammation and then you're able to get better faster, but I think you're going to get better without it. And no judgment on what that conversation looks like, but even just by asking that question, whether it's something, a sarcoid medicine, like a medicine that you may take long-term or intermittently, just to know what is the level of care I have to have about this, and how important is it, so that you can make those decisions. What alternative treatments are available, and why is this the one that's being recommended? That's an important one. I had a patient tell me a story one time about their child had a rare medical disease that could be treated with either an infusion that was about $10,000 and had a high risk of side effects, or with prednisone. And this parent didn't find out that prednisone was actually an equal option. It wasn't like first line, second line with a large degree of benefit on one side or the other. They were sort of equally recommended. And the parent didn't find out about this until after their child had a bad reaction to the infusion. So, just being able to say, okay, I hear you and I understand that this is what you feel is best for me. Do you mind just letting me know, like, what is it about this? I also, I'm having this back pain. I know that physical therapy is something like, why are you recommending surgery over physical therapy? Or why are you recommending, having that conversation gives you a lot of information that allows you to make better choices. Are there changes in my diet or lifestyle that would help my condition, either in addition to or instead of the treatment? That's when we often forget. And I think as a clinician, I forget to tell people that, oh, also you could do this and that might help. Maybe the patient chooses to do that or not, but either way, that's an option that you want to know about. When should I expect to feel better? So you've gone to the doctor, you're getting a treatment for something, whether it is a chronic condition, and this is something that's supposed to treat a longstanding problem or an acute problem. Either way, when should I expect to feel better? Because I need to know that if I'm not feeling better in 3 days or a week or 2 weeks or whatever that looks like, well, what do I need to do? When do I need to call you? When do I need to come back? When should I go to the urgent care? When should I go to the ER? Understanding what that looks like, what that process looks like, makes it much easier to not be standing in your kitchen at 11 o'clock at night, filled with anxiety about should you go to the ER or what sort of problem is this? Because, you've had a chance to sort of think that through with your doctor, who's the expert, to give you really the answers to those questions. And then when do I need to come back? Because the answer is you always need to go back, whether it's I'll see you next year for your physical, or it's you need to come back in 2 weeks. It's nice to know when that follow-up. Why do we emphasize follow-up? Can't you fix it now? The biggest reason is that symptoms evolve, which I'm sure that this group is all too familiar with, that you think you first get the symptoms of something that's going on, and as a clinician, we go to, well, what's the most common thing? We try to rule out the big scary thing that can't wait, that's maybe time sensitive or very urgent to know, and then we say, okay, well, I think it's this. Let's try this and see what happens. And many of you, like I said, have learned this the hard way of, you start to treat something and then it doesn't get better, or maybe your symptoms change, and that sort of allows your clinician to zero in on it. But that's one of the reasons that we really emphasize follow-up. Sometimes there are negative effects to the treatments. So, even the most benign medications, even the most innocent medications, have negative effects sometimes. I had a call this week from a patient who experienced one of the big scary black box warnings on a medication that they were taking. And, the conversation ended with, I really think you as the patient made a really smart decision by taking that medicine. And I think your clinician made a really smart decision prescribing that medicine. Everyone did the right thing. Everyone was doing the best that they could with the information they had. but this was a big scary, side effect, and that happens sometimes. So when there are negative effects, obviously we need to deal with those. Oh, look at this. And so, that's another big reason to have a follow-up, just in the queue and knowing when to go back and check on things. And the last thing that I think also doesn't get enough press is people need a more tailored approach sometimes. So in the emergency department, people will come in with very high blood pressure sometimes, and it's my job to discharge them once it's safe, to their primary care physician. But sometimes they're not going to be able to get into their primary care for maybe a week or two, and I want to place them on a blood pressure medication. And if I had to guess, I would say I've probably prescribed, I don't know, hundreds, maybe thousands of patients blood pressure medicine as I've discharged them. And honestly, like this list here, this screenshot, when I searched for it, it said, what would you like to know about the 250 medications that impact blood pressure? And, I don't really just, roll the dice, right? Like there are best practices about what is first line and what is second line. But the point I'm really trying to make here is that of these 200 plus medications and these hundreds of patients that I've seen, I don't know that I'm prescribing the best medication for that patient. And I also don't know, I'm almost certain it's not the right dose, right? Maybe they need a higher dose, maybe they need a lower dose, maybe they need a different type of medication altogether, but it's an iterative process. And understanding that it's not a failure, it's not your failure as a patient if you're on the wrong medicine and you just need more help or a different approach. You didn't do anything wrong. And a lot of times your doctor didn't do anything wrong. So, and I say that your doctor didn't do anything wrong and emphasize that, because I think what patients think a lot of times is they say, well, I don't want to like criticize my doctor. I don't want my doctor to feel like I'm not happy that they're like trying to take care of me or trying to do these things. I don't want to complain. But it's not complaining. It's just we have a lot of tools in our toolbox. We don't really have a great way of predicting which tools are going to be best for you and your situation, your body, your side effect profile, all of that. And so that's another reason that, we really need good follow-up. When should I expect to start improving? We talked about that one. How will I know that I need to be rechecked? And I would add, and where, like rechecked in your office, rechecked on a phone call, rechecked in urgent care. And under what circumstances do I go to the ER? So I think those are really the key questions that we need to hit there. A note on community. I'm so excited to be speaking to this organization because I see the help and the community that they're building here. And I think that that's something that, not all organizations have the vision or the resources to do. But I can say that it's not the patients with the best health insurance. And it's not even the patients who, have access to the most resources, like, the most family around them, or have the highest, the most letters behind their name, the highest education. Like those aren't actually the things that I see, at least from my side of the table, that really allow patients to thrive as they're navigating illness. It's really this sense of community. And I'm part of that community as a clinician, and, and your family is part of that community, but so are others who have the same struggles that you have, and who have, for example, several of the questions came in and it was like, they were just reworded questions of the same thing, right? Because interacting with the medical community is hard. Like dealing with illness is hard. Dealing with uncertainty when, the world just keeps spinning is hard. And I think that, there's something really special, and that I can see just as a clinician when I treat someone and they say, oh, well, I'm actually, I participate in this, this Facebook group or, this community, and we have fundraisers and we do these things together. And, having the patients be able to be there for each other and the families be able to be there for each other. Yeah, my mom also has sarcoid, like, and, the kids can see each other and like, and feel seen and heard. And I thought that was really special. And I know that you guys all know this better than I do, sarcoid and about this organization, but just, as a clinician, from the way that I see it, those patients can communicate better, right? So it's really the same message. Those patients have an expanded vocabulary. They hear about things that work. They come to me and they say, well, actually, I heard about this thing. Have you heard of it? And, half the time I'm like, no, why don't you tell me about it? And they'll tell me about a new treatment or a new drug or a new, approach. And I think that things like that can really make a big difference. And then, key takeaways, like really all of that stuff that I said, I really mean it. You are the decision maker. We are here to facilitate you making the best decision that you can in your life for your body, what protocol you'd like to try first. It's my job to say, I really feel that this treatment is going to, have the best chance of helping you, or I really think that this is critical for us to pay attention to when we're making these decisions, because these are the bad things that can happen and these are the great things that can happen. That's my job. But I do think that that sometimes in our system, that historically at least was paternalistic, and I mean paternalistic in the very true sense of, the physician, the medical professional was reaching out and sort of enveloping the patient and saying, this is how we're going to do things. And I don't think that we live in that space anymore. And I think that especially younger doctors, residents, are very open to having these conversations. And, even older people like me are open to having these conversations. And it's something that, especially when you are able to navigate the conversation by saying, I'm not questioning, your expertise and your experience. I just really want to make sure that, that I understand what you're saying, what you're recommended, why you're recommending it, so that I can do the best that I can to get better, because, that's what we all want. And I think that generally most clinicians are open to that. And honestly, and I have to like try to say this delicately, but if a clinician is not open to you coming to them respectfully and honestly, and just saying, I just don't think that I can go through with this. I just don't feel comfortable with this. I just need more information, or I just, would rather do this. Can you help me make this decision? And if that's not okay, having that conversation, then I would say, personally, I would consider if I'm in the right office, right? Are you in the right place? If you aren't able to have an adult conversation between peers, right? So that is my thoughts. And then on to questions. What is the best way you find to communicate with doctors not answering emails? I thought this was a really great question that I don't have a really great answer to, other than I completely understand how this happens. I was honestly, when I read this question, I thought, what doctor is even trying to answer emails? Like, go them. But also, like, I can't imagine a world in which, someone is able to do that successfully. But my question or my response to that would be, if I were having this experience, the way I would handle it is the next time I would go in, I would say, look, I know that you have like no time with your patients. I know that you're patient census. You're like the number of patients that you're required to see is astronomical. And I am so sorry but like, can you help me? Like, what's the best way? What works best for you for me to like ask you a question? Like, I try to get it all done when I'm here, but like, how do I approach this? Because I'm sure you don't want to answer emails and and then, they will have questions. Maybe they'll have questions. Oh, have you emailed and not gotten a response? Because this kind of thing happens a lot where things happen and the clinician just has no idea that you've been calling for a week and no one's answering the phones. We just don't know. We're like busy in the exam room doing all the things. So I think that just bringing it up to your provider, your clinician, at your next appointment is probably the best thing. And then you can also, you can talk to the front desk staff. You can talk to the MA that brings you back to the room and just say, hey, I've had a little bit of trouble like getting my emails answered. And, I try not to bug you guys, but like, what do you suggest? And sometimes the nurse or the MA can be just an amazing resource for how to go about getting a better response. How do you encourage all of your different specialty physicians to communicate and work as a team for your benefit? Huge, huge benefit if we could somehow do that. It was my naive understanding that somehow when we had all of these EMRs, like electronic medical records, that it was going to like make all of this information accessible. And maybe it has. I don't actually know, because the reason I don't actually know all of the things that are available and all of the things that I can find is because with the volume of information and the different, the 8,000 different screens on, something like, Epic or any of these EMRs, it's really hard for your clinician to justify the time to actually go through. So, most of us go into the patient chart and we look at things before we walk in the room, but that if you have, let's say in the emergency department, I have a little longer than maybe at a specialty clinic who only has 15 minutes, but if I only have a half hour, I know that every minute I spend scouring the medical chart is also a minute that I'm not having in front of my patient with my hands on the patient, talking about the history, talking about what's going on. So I think there's a balance there that we're trying to achieve, and it's not easy. And so I personally think, and I'm old school, I'm in my 40s. So like, maybe it's different for, younger people, but for me, what works best, I love when a patient comes in with a folder and they say, hey, just so you know, I just went to the oncologist last week. Here are the labs they drew. Here's the stuff. Or they hand me their phone and they tell me what appointment they had. They tell me where they had it and they tell me about the test. And they don't always know, right? But they'll be like, I don't know, they had the gel, they did the thing on my heart. Oh, an echocardiogram. Yeah, that's it. And so, any information, just you making sure that you have it written down in your planner or what have you, so that they can either then go back and do their chart review after they've talked to you, because you're like, oh yeah, and I had this other test done. Did you see it? Or, you having it with you. For me, that's always easiest because then I'm in the room and I can look at the thing and then have an opinion. I think that's helpful, but that would be, I think, the best approach there. And then again, if you have a situation where you're able to sit down at a desk in front of your doctor, you could just say like, hey, is there something I need to do so that like you can talk to my pulmonologist and who can talk to my dermatologist? Like, how do I do this? And maybe they know, maybe the front desk knows. The most important thing a patient can do to convey their message to the doctor, I think there's two things. I know that's not what the question asked. I would say the most important thing to do is to present a very clear picture of what your concern is. So what goes into that? Being as organized as you can be, right? Having things like the timeline, be important, or be outlined, knowing what med you're on, all of those things. But, to give an example, it's been a busy week. I had another friend who texted me and said, I'm not sure if I need to bring my dad to the emergency department. Here's what's going on. And this friend never texts me this. We talk every day. It was a weird thing, and it didn't make sense to me. So I called her and I said, why? Like, we talked yesterday. You didn't even mention that your dad was sick. Like, why would you text me today? And I'm not mad about it, but like, what was the thing? And the thing was, well, he's been sick, but today he couldn't get out of bed. Right. And so it's about finding that thing that is the red flag, right? That says, this is the thing that I'm concerned about. Or, the young people who end up in the emergency department and they're having chest pain, and, they could be having a cardiac event, but the likelihood is so low. Like, a lot of times, talking to that person and saying, we're going to do whatever workup we need to do, but I also need to understand, what is it that you're concerned about? I'm not upset that you're here. I'm happy you're here. We're going to take care of you. I'm not even worried about it. But help me understand, like, what's the big bad thing in the back of your mind that we need to put to rest? Because even if I do a great workup and I take care of everything that's going on, if I haven't addressed the thing that made you care enough to come to my office, then that matters. Did I lose you guys? Cool. So I think that those are the biggest things that you could do there, is just make sure that you're, being very deliberate about, this is why I'm here. This is my concern. This is the pattern and the change. And then, how do I tell my provider that I disagree with her protocol change based on how I feel? And I think that that's just the answer, is coming to the table and realizing that your provider actually wants you to say that the protocol is not working for you, because they want to help. And I am biased in this, but I honestly very strongly believe that people go into medicine primarily to help people, right? I mean, it's interesting to learn about science things, but there are a lot of other science jobs. It is a steady job that you can have, but there are a lot of steady jobs that you can have, right? No one goes into medicine just because it sounded like a good idea to go to school for 8 years and go into a bunch of debt and stay up all night on rotations. I mean, I really think that, the reason that your doctors and your PAs and your NPs are in the room with patients is because they really want to help. And I believe that we want to hear what's working and what's not working, so that we can make adjustments that we need to make so that you can get better and feel better. And this is my last slide. This is me at 2 a.m, waiting for an OR to be ready. And this is the website to be able to log in for that, the patient-facing publication. If anybody's interested, it's redflaghero.com. And I meant to put my email on here, but I didn't. It's Tiffany at tiffanyryder.com, RYDER. So that is what I have for you guys.
Yeah, we couldn't see the last slide, but maybe we could put that information in the chat, Tiffany, so everyone has it.
Sorry about that.
Oh, great. Great.
Oh, well. There it is.
Thank you. And we had such a great comment that I wanted to echo. It says, you sound like such an open provider who listens and doesn't get offended at questions about treatment. Yep. What do I do if my provider is not like you?
So, I mean, I think some of you at least know what I'm going to say. I can't say what anyone else can do, and it's not because it's a legal disclaimer or anything else. Because I genuinely feel that it's not my job to advise, but I can say that 20 years ago, if I had been in that situation, I would have said, well, they're the doctor, they know best. I'm just this person who's dealing with these issues. And, I guess I just don't know. And I would have just put up with it. But I can tell you definitively that if that happened to me now and I didn't feel like I could be heard, I would look into other options. I would need that because what I think you want in that relationship is, I mentioned all these things that you should do, right? Like I was very I feel like I did put some responsibility on the patients. Like, look, I expect you to tell me about whatever weird drugs you're doing or whatever weird sexual practices you're having. Like, it's fine. I'm not judging. I just want to know if it's related to why ever you're here. But in order for you to be safe in that place and be honest and come to the table and say, like, here's the weed I smoked last night, and here's the truth about the medication you gave me last time. I felt really anxious and I just couldn't take it. And I don't, I still don't think that I'm in a place emotionally where I can convince myself to take it. Like, in order for you to come to the table and be able to say hard things, you really need to know that someone's not going to, you know, jump into a big lecture or, demean you in some way. So, I mean, I do think that there's a difference in saying, I know you're really anxious and I know you don't want to take this medicine. I really don't have a lot of options for medicine. Like, this is like I really think like it would be great if we could get to you to a place to do this. Like, so like clearly I'm not happy that you didn't do the thing because I'm trying to help you, but I'm not like shaming you. And I think that's the dynamic that I would want to sort out if I was in that situation. Like, is this clinician like, is it that I haven't really been honest, or is it every time I bring something up, they're just like, I feel like they're yelling at me or they're like giving me a hard time about something and I just can't be the best patient. And if that's how I felt, then I would say, you know what, this relationship really isn't good for them. It's really not good for me. Like, is there someone else in the practice I can see? Or is there like, someone I can find online or, another option? So that would be my thought on that.
Thank you. I'm wondering back to your slide on the pitfalls and some of the recommendations that you had for a patient. Are there any ways that a caregiver or a spouse or a supporter of a patient kind of help guide them through their communication with their
Oh,
care
yes, there
providers?
are. I'm so glad you brought that up. I'm so glad. So, it's funny. I didn't know that you guys had done a similar topic on this until literally today, and I saw it, and I said, "Oh gosh, let me see." And she talked about this. I think it was from 2023, so you guys should go back and watch that one. But she talked about this, and I loved her answer because I think that having a caregiver with you really adds a totally different perspective. So, having someone else say, she's actually not like a whiner and she doesn't normally complain about her pain, but I'm telling you, like, she didn't even get into it. But like, she asked me for, whatever, to get her water all day yesterday because she couldn't get up and get it herself. She was, not drinking as much so that she could not have to get up and go to the bathroom, right? Like things like this are the things that family members say, and the patients, sometimes like annoyed with it. And I have heard that, some clinicians and some doctors are like, well, why are they bringing this person in? I think it's always a good idea if you do have access, it's always a good idea. They can write the questions down, right? They can have the piece of paper so that you're telling your authentic story. They're keeping you on track. Oh, sweetie, you told me that, you really wanted to make sure that we emphasized this. Oh, sorry. Actually, she really wanted to ask this question about this medicine. Do you mind if we ask one more? Right? It takes the onus off of the patient. Like, then the patient doesn't have to feel like, a jerk or a bother. They're already sick. They already are embarrassed or, or having all of these like emotional feelings about being there, or spending money or taking time off work or whatever it is. And so being able to share that and come in with a caregiver who's maybe holding the Life and Breath Foundation planner, I think is a really, really good strategy.
Thank you. I can relate to that so much as a caregiver myself. So I appreciate your comments. Well, as we're coming up on time here, I just wanted to thank you so much for this session, Tiffany. This was great, a really unique discussion that we can have with our sarcoidosis community. Are there any final comments or anything that you would like to leave with our
I mean,
listeners?
I actually do have one, if you don't mind, just because you set it up for me. I just want to say, that having to deal with a diagnosis of something as complex as sarcoidosis, I can't imagine what that's like. Can't imagine what that's like. And I think that's something that, I don't know if people are aware of, but I see it in the patients. The process of getting to the diagnosis is arduous, right? It is not straightforward. It's often like, oh, you have this. Oh, you have this. Oh, you're crazy. Oh, you have this. Oh, you're crazy. Oh, you're this, right? Like this is what these patients, and it's not just sarcoidosis, it's all of these like multi-organ, sort of non-specific starting syndromes, and they really aren't treated well by the medical system in a lot of cases. And, I guess like my one thing that I would want to say is that's not on you, that's on us, right? Like that's on this side of the table. And I think that a lot of patients, take that struggle and take that uncertainty, and then they become like sort of passive, and they sort of believe this like garbage that's been sort of like placed on their side. And I think just taking a moment to realize that, of course we're doing the best that we can. I don't think that clinicians are not diagnosing people on purpose or treating them poorly on purpose, but I think that a lot of times, unfortunately, that's the outcome of these long processes of being diagnosed. And that just because it took everyone a while to get on the same page, it doesn't mean that you weren't right to follow through, and that you haven't already succeeded by getting a diagnosis. Like you're here because you advocated for yourself. And I just hope that people are able to see themselves in that light and see how capable that they are to have got to this place, and then use that as just a springboard to, be in their own bodies and say, I am such an expert at this. You guys all know way more about sarcoid than I do. I know what I learned that one day in medical, education. So I think that would be what I would want to leave people with is educate your emergency medicine providers when you go in there on, what your sarcoid looks like and what you're dealing with and what your treatments are like, and just be proud and confident in the successes that you've had. That's all I got.
Thank you. Thanks for leaving us with those words of encouragement. That's a great way to end this discussion. And on behalf of the Life and Breath organization, we cannot thank you enough for your time and for this discussion. We appreciate everyone for listening in this evening. We hope that you will look into our other content. We have a great speaker for next month's series, and hope everyone has a wonderful evening.
Thanks,
Thank
everyone.
you.